Warm, gentle music starts and fades into the background. Before we start, please remember that this explainer is for educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always talk to your doctor or a qualified healthcare provider about any questions you have regarding your health.
Hello there. Talking about our health can sometimes feel a bit uncomfortable, but I promise, understanding what's going on with your body is such a powerful first step. So our goal here today is just to explain this topic in a really clear and gentle way, so you can feel informed and ready to take the next step.
All right, so first things first, what exactly is rectal prolapse? Let's break it down.
So in the simplest terms, rectal prolapse is when the rectum, which is just the very last part of your large intestine, turns itself inside out and slips out through the anus, the opening where you poop. To really get how that can happen, let's first take a look at how things are supposed to work. Normally, your rectum is held nice and snug inside your body by a whole network of muscles and tissues that keep it in place. But if that support system gets weaker, the rectum can start to slide down and, turn inside out. A good way to picture it is like a sock turning inside out as you pull it off your foot. That's kind of what's happening.
So what might you actually notice if this is going on? Well, the most common thing is feeling a bulge, like something is coming out of your anus. You might also notice a little bit of mucus or blood, have some trouble going to the bathroom, or maybe find it's hard to control gas or stool. Okay, so now we know what it is. The next big question is why? Why does this happen in the first place?
So what's really going on that causes the body's support system to get weak like that?
Well, it pretty much always comes down to the muscles that support everything down there in your pelvis. And honestly, the best way to picture this is to think of those pelvic floor muscles as a strong hammock.
See, when those muscles are healthy and strong, they act just like a nice tight hammock, holding up all of your pelvic organs, and that includes the rectum, keeping everything right where it should be.
But if that hammock gets stretched out or weakens over time, it starts to sag. And when it sags, it just can't provide that strong support anymore. That's when organs, like the rectum, can start to slip down.
So, what can weaken this hammock? The single biggest reason is straining a lot when you're trying to poop over a long period of time, which usually comes from being constipated. Other things that can contribute are childbirth, just the natural process of getting older, and sometimes having had surgery in that area before.
Okay, so we've covered the what and the why. Now let's talk about the most helpful part, what you can actually do about it. These are some really clear first steps you can take. There are 3 really key things to think about. Number 1, and this is the most important, is to talk to your doctor. You need a proper diagnosis to know what's really going on. Number 2, try to avoid straining or pushing too hard when you go to the bathroom. And number 3, work on managing any constipation. Your doctor can really help you figure out the best ways to do that. Now, we need to talk about something that's extremely important. I need you to listen very carefully here. While this condition isn't usually an emergency, there are a few urgent warning signs that you absolutely have to know.
If you experience any of the symptoms we're about to talk about, it's a sign that you need to get medical help right away. So please pay close attention to this next part. You need to get help immediately if the bulge won't go back in, even when you apply gentle pressure. Also, if you have pain that's really bad and it's getting worse, that's another sign. And finally, and this is a big one, if the tissue that's come out changes color, if it turns a dark red or purple or even black, any one of those is a sign of a serious problem, and you need to see a doctor right away.
The main thing to remember here is that this is a treatable condition. The most powerful tool you have is knowing what's going on. Just understanding your body and what to look for is the very first step to getting the right care.
So, as we finish up, I want to leave you with one final thought. Being prepared for your doctor's visit can make a huge difference. So think about it. Based on everything we've just covered, what's the one question you'll be sure to ask?